Background of the course. Coronavirus have been depicted for more than 50 years. The separation of the prototype strain JHM of murine coronavirus, for instance, was recorded in 1949. The initial human coronavirus, HCoV, was actually isolated through 1965 from the patient's nasal discharge with the popular called and named B814. Coronavirus are actually positive-strand RNA envelope viruses that generate localized but moderate respiratory tract contagions in a broad variation of animals containing mice, pigs, cows, birds, and horses. 6 coronavirus kinds are recognized to cause human illness. 4 viruses, NL63, 229E, HKU1, and OC43, are predominant and typically create popular cold signs in immunocompetent persons. The 2 other strains, SARS-CoV, severe acute respiratory syndrome coronavirus, as well MERS-CoV, Middle East respiratory syndrome coronavirus, are actually zoonotic in source and have been connected to sometimes deadly disease. One of the merits of MERS and SARS outbreaks is anyway heterogeneity in transmissibility, as well in particular the happening of super spreading cases, especially in hospitals. Coronavirus CoVs are recognized to cause respiratory, neurological, hepatic, and enteric ailments of modifying severity in a set of animals. However, they are presently categorized into 4 collections: alpha coronavirus, beta coronavirus, gamma coronavirus, and also delta coronavirus. The spread of COVID-19 pandemic virus anyway has been led to universal consideration and was proved as a pandemic virus via the World Health Organization WHO on March 11, 2020. COVID-19 coagulopathy is associated with notable mortality and morbidity. Proof of the improvement of coagulopathy is obtained from fundamental blood investigations, the observation, fibrinogen, the dimer, and FDPS levels. It was recognized that a novel COVID-19 generated from China and speedily crossed whole borders by infecting people of all age categories through the entire universe. This COVID-19 pandemic shares in a prime global challenge, together with a massive yet probably underestimated burden and abundant unidentified proceedings. This phenomenon has various global burdens like mortality, morbidity, economic crisis, political crisis, load on healthcare providers, great public reaction, and closure of schools. However, this course addresses the notion of communication and strategical communication and suggests a modern lens through which to see communication in order to grow knowledge of strategical communication, also to notably develop the alignment of strategical communication with desires of the day's strategy improvement procedure beside COVID-19 crisis duration. People who have cured from COVID-19 appear to own elevated levels of both T cells and neutralizing antibody, and matched with severe cases in the respiratory tract, milder case of COVID-19 on larger numbers of memory CD8 plus T cells. Intelligent communication amongst healthcare professionals is an instant issue participating to prevalent barriers to patient welfare. Combining theories in social scientific survey has recently obtained activity through a research strand named Mixed Methods Research, MMR. The aim of Maram Shtaya approach anyway is to develop health. This demands first that scholars guarantee that interventions they improve and assess can be widely applied, and second, that their assessments supply definitive evaluation of effectiveness and efficacy. Therefore, Maram Shtaya approach supplies a system that can assist with both missions.